Hi, everyone. My name is Joanna Sinwell, and I'm on the board of the Johnson County NAMI. And we are a very active affiliate, and we do these lunch and learns every month. And this one, we're welcoming Sara Schwartz. She uses the pronouns she, her, and hers. She is a clinical social worker. She received her BA in social work from Concordia College in Moorhead, Minnesota, and her Master's of Social Work at the University of Iowa. She has primarily worked in the field of substance use and mental health during her career, including positions at House of Mercy in Des Moines and at the University of Iowa Hospitals and Clinics. In 2016, she joined the Iowa City Veterans Administration as a social worker in the outpatient substance abuse treatment program. She transitioned to the local recovery coordinator position in 2020, and in this role champions recovery-oriented language, coordinates mental health summits, and provides individual and group therapy, including ACT, CBT, and DBT. She's involved in a multitude of committees and groups and is passionate about serving others. We welcome you, Sara, and we'd love to hear all about the Iowa City VA health system.
Great, wonderful. Thank you, Joanna.
Thank you.
In developing this, it was kind of a broad ask. And so I want to start actually kind of with more of a question for you all, and feel free to put in the chat or come off, speak off mute, excuse me, and let me know if there's any questions you have to begin with, or anything in particular you really want me to make sure to talk about. And again, I'm pretty informal, so feel free to ask questions as we go. But is there anything right offhand that anyone can think of that you really want to make sure we address or talk about? One in the chat. Placement issues. Okay. Got it. And when you say placement issues, would you be able to elaborate a little bit about what you mean by that, Tabitha? Okay. Okay, great. Yep. Homeless or no longer able to care for self. I'll definitely be talking about both of those. Anything else that comes to mind right away? Okay. Well, as we go along, if something pops up, please, again, feel free to put it in the chat, let me know. So just brief overview, a little background about the Iowa City VA. It was founded in 1952, and it covers 50 counties across Iowa, Illinois, and Missouri. And there's more than 100,000 veterans within what we call our catchment area that have services available to them. So it's quite a few who can access the VA if they choose to. And of course, this is the actual building, if you've ever been here, located in Iowa City. So I'd like to take a moment as the recovery coordinator to talk about our approach to services as well, and how important that is, and how we think about mental health care. So we offer recovery-oriented services that are research-based and address the entirety of the veteran, including the different facets of them. And I think the VA is unique in that we consider different parts of healthcare, such as homelessness and other services that kind of traditional healthcare is not included. And I see that Nancy put in peer supports. Definitely, yes, I'd love to talk about peers too. So just a quick overview. Well, not so quick. It'll be a little while. First, there's our mental health programs. So we have our acute mental health unit, which I'll take a moment to talk a little bit about, and then 14 outpatient programs. And I'm going to talk about some of them, but not all of them. And I'm loving the chat. This is very helpful. Support for family of people with PTSD. Okay, great. So we'll make sure to include that too. And so this might address a little bit about the placement that I think Tabitha mentioned earlier. So we do have an acute mental health unit, and it's located on the 9th floor on the west side. So we call it 9 West. And it's going to be for veterans who are experiencing a crisis. It is a safe, recovery-focused environment. And there's a multidisciplinary team there to address veterans' needs. So we have a psychologist who is full-time dedicated to the unit, a social worker who does help with the placement, like previously discussed. And we have a peer who provides groups as well. And some other services include a recreational therapist, a music therapist, and chaplain services, all that come to the unit and provide services. I'm not sure if Tabitha, if there's anything else you want me to talk about as far as placement regarded to this population of veterans. Any issues placing older veterans? Yes, so veterans who have dementia and Alzheimer diagnoses, there has been a bit more of a challenge with finding placements for them, unfortunately. There is the Veterans Home, which is in Marshalltown, which of course the veterans must apply for and meet criteria to go to. And finding appropriate skilled nursing facilities and appropriate level of care has become a bit of a challenge because there's many reasons for that. I mean, during the time of COVID, of course, there's been some locations that have had more. Yeah, I would say there tends to be less options available than before. I did agree with that. Some and we have a specialty who just does contract nursing. It's a social worker and a nurse, in addition to the social worker who's assigned to the unit. And I think there's always kind of an ebb and flow as far as the facilities that are available. But I'm not so much in that world, but from the outside looking in, I do think that there's fewer options in general. Yes, I'd agree 100%, Joanna. Very sadly true that most people with severe mental illness who need residential care, there's just not as many options. Since we do also cover part of Illinois, that does open up some options there as well. But it's been a bit of a challenge, unfortunately, for placement. Yeah, no problem. And so talking a little bit about individual or outpatient mental health, excuse me. So these services are fairly comprehensive. We have individual and group psychotherapy, and as listed here, consultation, evaluation. We have psychiatry providers on staff, a full substance use disorder program. We don't offer residential treatment for substance use here, but we can refer veterans to VA residential programs. And something that's, I think, kind of unique to the VA is we have mental health providers who are embedded in mental or primary care teams. And so if a veteran were to present to a primary care appointment, for example, and they screen positive for depression, then they could be seen the same day by a mental health provider, and then have some short-term therapy with them, and then if needed, be referred on for longer-term therapy. So there's some good resources there available. Oh, cool. Love that. Making sure I'm getting through the questions. So I don't know if anyone talked about work, so I don't know if I'll go as into much detail with this, but voc rehab or compensated work therapy is also a resource available for veterans. And so for the supported employment is for veterans who have serious mental illness, so helping them to engage in competitive employment in the community. And then transition work is when veterans get placed more at the for work, the hospital or community work sites. And we're actually expanding our vocational rehabilitation services, which is exciting. I believe we're going to be able to offer some more in the Quad Cities in the future. And so really being part of the primary treatment team and thinking about work as treatment, work as therapy for folks in their path. So homeless services, we have several different programs, and so the homeless prevention programs overview, I'll just kind of touch on each of those. That could go into a much longer conversation, so I won't do all of them today. Community resource and referral centers, and then the Veterans Justice Program. So the homeless prevention programs, when I think about it, I think of healthcare for homeless vets, or HCHV, is kind of the entryway to all of the other services. So those are staff who are really kind of boots on the ground, doing outreach, going to places where there are homeless veterans and who are living on the street or institutions. And then from there, they're generally funneled into the other programs, which some of you may or may not be familiar with. So grant and per diem is a time-limited, service-intensive transitional supportive housing. So that goes up to 24 months. HUD-VASH is a collaboration between Housing and Urban Development and the VA. And they give vouchers to veterans and their families. And veterans also receive case management to obtain and sustain their housing. And then SSVF or supportive services. And that's for very low income veterans. That program also provides case management and supportive services. And that's if there's to prevent an imminent loss of a veteran's home, they can provide rapid rehousing for a veteran and their family as well. All right, so community resource and referral centers, and these are really great services that are kind of wrap around in two communities. We have one located in the Quad Cities and one in Cedar Rapids. And they are for veterans and their families who are homeless or at risk of becoming homeless, and they can access VA and non-VA services there. So a veteran needs to be eligible for VA healthcare to receive direct services from the team, but if they're not VA eligible, they might be eligible for the grant per diem program or community services. So they have showers and laundry. There's usually food pantry and clothing available, as well as community partners there to help with legal issues or other needs. And pretty proud that Iowa City VA is the only VA in the country that has two CRCs. So that's a pretty big deal for us. So for veterans who are involved with the criminal justice system, we have the Veterans Justice Programs, and the Veterans Justice Outreach is really providing direct outreach, assessment, and case management for any veterans who are involved with courts and jails. So they can assist veterans with perhaps their needs would be better met at a residential treatment facility, for example. And so the VJO staff are able to help support the veteran through that process, get the referrals they need, and get connected to the care that they need, with the goal of trying to avoid unnecessarily criminalization of mental illness for veterans. And then healthcare for reentry veterans is for veterans who are currently incarcerated, and to try to prevent them from experiencing homelessness when they are released. And so a lot of planning and preparation occurs with the HCRV team in preparing veterans for the next step in their journey. Okay, so I'm making sure doesn't look like there's any questions in the chat so far, so I'm going to keep going. Intensive Community Mental Health Recovery Services, or ISMR, because we love all of our acronyms, is outpatient community-based mental health programs. And so there's two programs. One just more kind of recently got developed. So we have Mental Health Intensive Case Management, MICM, and they're going to be serving more urban veterans. And both programs serve veterans who have a serious mental illness diagnosis. And the goal is to keep them in the community. And so they're wanting these staff goes into veterans' homes. They could provide medication management. They can go on community outings. They can bring all of the services to the veteran wherever they are. And then RANGE, which is Rural Access Network Growth Enhancement, is for more rural veterans. And that is kind of based more out of the Quad Cities. But we're trying as best we can to make sure that we're getting those veterans connected and kind of providing those services, like I said, to keep them in their community and out of the hospital. Home telehealth program. It's an option for program for veterans at home to access their healthcare team. They can use a messaging device or a phone, and home telehealth staff can help kind of monitor individuals who have different mental health diagnoses like depression, schizophrenia, psychosis, kind of those types of diagnoses. And so they're not going into the home, but they're available kind of more readily and providing that support. So I like to include military sexual trauma. It is not a specific service in and of itself, but I like to talk about it because it's so prevalent, unfortunately, among veterans, and something that we assess for with all veterans. And if appropriate, some might receive services related to an MST experience. So military sexual trauma, for those of you who may not know, is a term used by the VA to refer to experiences of sexual assault or threatening sexual harassment that a veteran experienced during their military service. And we know both men and women can and have experienced MST, and the identity of the perpetrator, where it occurred, whether the service member was on or off duty, none of those things are really important. If a veteran says that I experienced this, then we say, okay, how can we help you, essentially? Thankfully, many individuals recover from the experiences of trauma. However, if individuals do have ongoing physical and or mental health conditions related to it, then those services would be free through the VA. The Psychosocial Rehabilitation and Recovery Center, or the PRC, is an outpatient treatment center for veterans who have serious mental illness and severe functional impairment. And the goal is to help veterans experience recovery and integrate into meaningful, self-determined roles. The program is curriculum-based, and as you can see, kind of the different skills that are offered. Right now, it's both virtual and in person, and I foresee it'll probably continue that way. But with moving towards more virtual, there's been a bit more rural veterans who are able to access it, which has been positive. The outpatient substance abuse treatment program is our substance use disorder services. And as I mentioned before, we offer outpatient and intensive outpatient treatment services. We also have a social worker on site at the hospital who is available to go anywhere in the hospital to provide services. And as someone mentioned earlier, peers, I also am a very big fan of peer support, and we have 2 peers currently, and I believe we hope to add more to our substance use disorder program. And so that's a place where there's a lot of great resources with kind of the peer connection. And I apologize, I forgot to mention before that through the homeless program and at 2 of the community resource and referral centers, so one in the Quad Cities and one in Cedar Rapids, there are also there's a homeless peer embedded in those programs, so they are available for veterans at those locations too. So we have a suicide prevention program that is also part of our services offered. They provide a variety of services such as case consultation, outreach and care coordination to veterans who have been referred from the Veterans Crisis Line, employee training and education. And there's been a lot more movement with community outreach and coalition engagement in the past few years, which is really great, I think, because we know without partnerships, we're not going to be successful. And so working together, our efforts will be much better and reach more individuals. And vet centers are a really fantastic resource. We're lucky to have 2 of those as well. We have one located in East Moline and another in Cedar Rapids. And they offer readjustment counseling and for veterans and just kind of a variety of services. They were set up for veterans who've experienced combat and also military sexual trauma, but they've expanded their services in the past few years for who all is eligible. So I will be sure to give some resources for how to connect to the vet center if anyone's interested. But it's a really great resource. They offer non-traditional hours and lots of times really neat groups like a guitar group, or I think they've done like glass blowing, things like that before. That's kind of broad and unique at the same time. And I know that there was some interest about rural health, and when I stop sharing, I will put two resources in the chat. But there's the Office of Rural Health Home, and that resource offers just general broad overview of rural health services for veterans. And then there's also ways to look at partnerships with external organizations, if that would be of interest in the future. And then there's the Rural Connection quarterly newsletter, which can be just another great resource, more data and information about kind of what's happening within that world. So the Iowa City VA is one of 5 VAs in the country to have a veteran rural health resource center. And so it's a field-based satellite office that serves as a hub of rural healthcare research, innovation, and dissemination. So its functions include administration and operations, so overseeing the day-to-day operations of the Veterans Resource Center. They do studies, so they respond to requests from the Office of Rural Health to prepare longer-term studies of matters affecting veterans living in rural areas of the U.S. Innovations, they develop and pilot test innovations in the delivery of care and services to rural veterans. So they're kind of field-based laboratories for clinical and non-clinical pilot projects. And then they also do promising practices, dissemination, and technical assistance. So they disseminate Office of Rural Health rural promising practices through mentored implementation to targeted stakeholders inside and outside the VA that emerge from clinical and non-clinical pilot projects, and provide technical assistance and program consultation on programs, pilots, projects, and issues affecting rural veterans. So you can see their 4th bullet point there is that develop innovative mental health treatment delivery models for rural veterans. These are specific to the Iowa City Veterans Rural Health Resource Center. These are our specific rural focuses. So there's kind of always new pilot projects, new information coming out of these. So I wanted to do just kind of a broad overview instead of just pick one to talk about. And then accessing services for rural veterans. I wanted to talk about kind of the 3 main ways that are really helpful for rural vets to get care. So for starters, having clinics in rural locations, telehealth options, and the clinical resource hub. So the community-based outpatient clinics, or CBOCs, we are fortunate to have many. And I don't know if you guys are seeing my mouse, but anywhere that has the black with the name is a location where we have primary care and mental health services. So you can see we have some rural locations such as Decorah, Ottumwa, and Quincy. This is an outdated map. I couldn't find a new one, but there's also one in Des Moines County and Burlington as well. And so this is really helpful for veterans who, instead of having to come all the way here to Iowa City, they can go to their local clinic and get care. Telehealth, appropriate in general. Most mental health services that are offered can be provided via telehealth, and that can be from the veteran's home, a private location in the community, and also from a VA clinic. If eligible, veterans may be issued a VA iPad to participate in mental health care. And one of the criteria is their distance from a VA clinic. So really taking into consideration rural veterans and their needs. And then, as I previously talked about, the home telehealth program, which can be adjunctive to any mental health and primary services. And then the Clinical Resource Hub, which has really taken off since 2018. And these are fashioned in a hub and spoke model. And their Iowa City VA is kind of within the Midwest region. And so there's staff, mental health staff who work for the Clinical Resource Hub, who are provide tailored mental health care services to veterans throughout our region, and really with a focus on offering it to rural veterans who maybe can't get to the clinic even, and getting their needs met more quickly with staff who are primarily all virtual. But it's kind of an ever-expanding program, and a way to fill those gaps and also kind of address the workforce shortfalls with retiring or exiting healthcare workers. So accessing resources, the first number is the, oops, that's funny. I don't know why I did that. Number 2, enroll. And then the second is how to apply online. Make the Connection is a resource for veterans who can listen to other stories of other veterans who have been through similar experiences as them. You can actually search, say, if a veteran has anxiety, you can search by that and listen to and watch a veteran talk about their experience with getting treatment for anxiety and what their life is like now. And then the locator is a fantastic tool. It can offer resources like for PTSD treatment facilities, just kind of general mental health services, and looking throughout the whole country and not just locally. I'm sure many of you already know that the Veterans Crisis Line number is 988 and just press 1, but we like to continue to spread the word about that. The Community Provider Toolkit, like I said before, we know we can't do this without without you all. And so this is a really helpful information and tool, especially for community partners and providers. If someone knows a veteran who has a family member of a veteran who they think could benefit from accessing care, coaching into care is specifically for family members. So it's a 1-800 number listed there, and it's a fantastic service that can help kind of talk about the frustrations as a family member and thinking about how can I help my loved one get connected to the services that I see that they need. Then the vet center also has a call center, and so it is available for veterans and their families to call, and it's staffed by combat veterans, and it's free, so they can connect with someone whenever is needed. And so I'm going to look up really quick, I think peer supports in VA. I wasn't sure if there was anything else you wanted me to talk about with that. How many veterans did we serve in 2022? Is that the question?
Yes, I was just wondering, just the total number of vets.
I don't know the number right offhand.
Okay.
I can find out for you though, if you'd like.
No, it's fine. I
Okay.
bet it's a big number. And I think it probably would be, given how many vets I know that use a system just in our neighborhood. I live in a neighborhood with older people, and many men are vets, and there's a group that meets, I think it's on their own, but they meet.
Oh, cool.
Yeah, they meet at the, Hy-Vee, a little cafe, and have coffee once a week.
I love it.
Yeah.
That's fantastic. I'm going to put this up, and I don't know if anyone. Okay. I threw a lot of information at you all, so the takeaway is we're here. If you don't remember anything else, my name, my contact information, please consider me a resource and a contact for questions for the VA and how to access services. We want to continue to form partnerships and not be quite so siloed as we have in the past.